this is Robbie. He's a patient of mine. He is interested in enhancing his looks by having a mandibular wraparound implant. Robbie, why don't you tell us in your own words what your concerns are and what you want to accomplish with this procedure?
Yeah, totally. I feel like I want some more definition around the chin area
Okay.
and to enhance the mandibular region of my face too.
Okay,
Yeah.
that's perfect. So this procedure, a mandibular wraparound implant, will go from one side of the jaw. Basically, will enhance the jawline, the mandibular border, the body of the mandible, as well as his chin area will be enhanced. The implant will also extend to the other side, and it goes all the way up. I can't wait to show you his surgical and post-surgical procedure. So we'll take you through that. Thank you. Good morning. Today is the surgery day. We're going to be doing a mandibular wraparound implant. Really exciting. The procedure should take about an hour and a half to 2 hours. We'll be performing that under IV sedation. The procedure is really simple, Robbie, but like I said before, you're going to have some swelling in your face, and which will subside within the next 10 to 12 days or so. But the significant result that you will see and the final results will be about 2.5 to 3 months or so. So I ask you to be patient and just bear with us until your entire swelling goes down, and you're going to see the final results. I think you're going to love it.
Thank you. Thank you, Doc.
Yeah, of course. Do you have any questions for us today before we go in?
Yeah. I was just going to ask, where are you going to be making the incisions?
Great, that's a great question. So there will be a small incision under your chin line right here, which will be really inconspicuous. No one can see that. And there are also going to be 2 small incisions inside your mouth where we pass the implant. So in our next video, you will see that we will make those incisions, and they're really small, and they heal really well within the next few days or so.
Cool.
Great. Well, looking forward to it. We're going to take you back to the OR, and we're going to get started. Thank you.
Thank you.
Mandibular implant. He's getting some about 10 millimeter projection here, about 4 millimeters of vertical height, and obviously this area here is the key where we are, kind of chiseling his mandibular angle area. So because this implant is so large, we're going to cut it right in the middle, and we're going to feed it through via suture through the mandible, which we'll show you how. I'm just going to go slightly to the side, so we know where our midline is. All right. So we're gonna, the implant is gonna go through here, through the suture. So. Hey, Robbie.
Hi, Doctor.
How are you? Good to see you again.
Nice to see you. Nice to see you.
So 2 weeks, huh?
Yeah.
You survived this, man.
I know.
That's awesome. So I think you look great. You still have some swelling going on, but eventually that will go down. I can't wait to see the final results, but you already look absolutely awesome.
Thank you. Appreciate it.
Looks great. Yeah. So tell me, how has your experience been for the past few weeks?
Oh, I think the first week was pretty brutal.
Yeah.
Yeah, there was a lot wrong. It was
a lot of swelling.
A little bigger than I thought. I was worried a lot for the first week, but the second week, it seems like there was a lot of recovery, and I really happy with the shape.
Awesome.
Yeah.
That's great. How does your friends think about you?
Oh, they
Your
love it.
girlfriend?
Yeah, they think it looks super nice, fits my face.
Yeah.
So, yeah.
Awesome.
Super
That's
happy
great.
about that too. Yeah.
That's great. So yeah, you still have some swelling. Like I said, it's going to take about 2 to 3 months for the entire swelling to go down. But right now you look really good, and you're eventually going to get better and better every day.
Thank you.
For the next couple of months.
Cool.
Can't wait to see the final results.
Awesome. Yeah. Awesome. Okay.
Any questions for me?
Yeah, I was just asking where do you see like the most swelling?
I see them mostly here and probably a little bit here.
Okay.
So those are going to kind of settle in for the next month or 2 months.
Got it.
It's fine that you have a beard now. Next time when I see you, you're shaved up. You're going to see a lot more chiseled area here because all the swelling is going to go down, and this area is really going to define really well. So can't wait to see you.
Cool, I'm excited.
Great. Thank you so much for coming in.
Of course.
We'll see you in 1 month.
Okay.
And make sure you shave so we can see exactly what's going on.
You got it. You got it.
And we'll go from there.
All right. Thank you.
Awesome. Thank you. Hey, how are you?
Doctor, nice to see you.
Nice to see you. All right, so 2-month follow-up. How's everything going?
It's going well. There were days where I thought it wouldn't be okay, but it's a lot better now for sure.
That's awesome. That's great. You look awesome.
Thank you.
You look really good.
Appreciate it.
So, tell our audience what you had done and how your experience has been so far with your mandibular wraparound implant.
Yeah, no, totally. It was a long process. I had kind of it emphasizing this area and this area, and for the first few weeks it was really numb.
Yep.
And it kind of felt like the pain would never go away.
Yes. I know.
And it took a while for the swelling to go down for sure, but I'm super happy with the way it looks right now.
Awesome. Yeah. So usually this procedure, Ravi had an implant that went through from here all the way down to the back side. We augmented the chin and also the size of the jawline. He wanted to have more of a chiseled look area. As you guys, we have talked about this before on our previous videos. So usually this takes about 3 months for the final results to occur. So it's been 2 months for him, and I think he looks great. And I think he will have some more, time to go before all the swelling is gone. But I think he's almost there. So you look great, Ravi. Thank you so much for coming and sharing your experience with us here. And I will see you one more time just to go for a follow-up final visit, and then we'll go from there.
Appreciate it.
Thank you so much.
Thank you.